While reviewing berberine and metformin for Healthspan benefits, I realized that this is a bit like deciding between traditional medicine and Western medicine. Let me explain. Both berberine and metformin, they've got a traditional origin. The discovery of metformin dates back to the 17th century, where the French lilac was used as a herbal remedy to relieve the intense urination caused by diabetes. Berberine, on the other hand, has been used in Chinese medicine from around 3000 BC. And in the 1960s, that's where drug companies got a hold of the French lilac and manufactured metformin. And they did this to isolate the key ingredient that was causing the benefits from the French lilac and made sure that that ingredient could be absorbed by the body. Berberine, on the other hand, is still in its natural form, but because of that, it's got poor absorption into the body. And even the small amount of berberine that can be absorbed, most of it is broken down by the liver. That's the first big difference between berberine and metformin. One can be absorbed really well, but the other one can't. When it comes to how these molecules work, both of them activate an enzyme called AMPK, but berberine, it also activates something different, which we'll talk about later. AMPK is an energy sensing enzyme that signals to the cells that they need to absorb sugar, they need to absorb glucose. It also reduces the amount of glucose that the liver creates. There's substantial evidence suggesting that problems with AMPK leads to metabolic syndrome or type 2 diabetes. And when tested in the lab, berberine potently activates AMPK. The same with metformin. So let's unpack this. In my type 2 diabetic patients that I see in the clinic, the first thing that I recommend to them is a low sugar diet and regular exercise. But sometimes that's not enough. And the first medication that I prescribe is metformin, and this is because I want to activate AMPK. When I'm treating my patients, I want to know that the medication that I'm prescribing to them, they can absorb it and it will have an effect on the cells. But the same can't be said for berberine. Like we've gone through, the body struggles to absorb berberine, so it only weakly activates AMPK. Plus, I want to make sure that anything I'm prescribing has got manufacturing oversight. So for example, in 2020, the FDA found that metformin, it may contain an impurity that causes cancer. So the batches of metformin that may have been affected were recalled and the problem was fixed. So when deciding to activate AMPK, I want to do it properly, and I do that by using metformin. But that leads us on to the second question. Is activating AMPK a good thing for non-diabetic patients? I recently did a video on metformin explaining some new research that has come to light on non-diabetic patients. Overall, it seems that activating AMPK by using medications or supplements for non-diabetic people, that's crucial, doesn't appear to be a good idea. So let's go through the research. Initially, there was exciting data coming out suggesting that using metformin may extend health span. So for example, in 2014, it was found that type 2 diabetic patients who were treated with metformin seems to have a 15% better survival rate compared to people without diabetes. But the important thing to know about this data is that it's looking in the rearview mirror. It's an observational trial. And when the interventions testing program trialed metformin in 3 separate labs, there was no lifespan extension. And that brings us onto the latest trial of activating AMPK in non-diabetic patients. Towards the end of last year, a paper was published that followed over 3,000 adults at high risk for developing type 2 diabetes, and they were followed up for 21 years. It was a randomized controlled trial comparing metformin to placebo, and overall, although metformin prevented diabetes, it did not reduce all-cause death rates, cancer, or heart disease. So for non-diabetic people, trying to activate AMPK by using supplements or medications probably won't give us any benefits. However, it may cause problems. In 2019, a paper was published that showed that metformin, it reduced the benefits of exercise. So after 12 weeks of training, metformin, it blunted the improvement in VO2 max by around 50%. And after looking at all of this data, it doesn't look like metformin or berberine should be used to activate AMPK for non-diabetic patients. But let's move on to the second pathway that berberine influences, which is completely separate to metformin. Berberine appears to block an enzyme called PCSK9, and this has important effects for our cholesterol. By blocking PCSK9, we encourage the cells to absorb LDL cholesterol. Therefore, there's less LDL cholesterol in our bloodstream causing problems. So let's have a look at the human data for berberine and cholesterol. We've got a 2018 systematic review which combined 16 different trials with a total of over 2,000 people. Unfortunately, these trials had high clinical heterogeneity. All this means is that the results from the trials were very different. So if we would be seeing a positive effect from berberine, most of the trials should be showing that benefit. However, some of these trials were showing a benefit and others weren't. So this is what we mean by high heterogeneity. The clinical trials are producing different results, so it can be quite difficult to interpret them. And when trials are showing different results, it's often because the methods for those trials are low. So yes, when the data is combined, berberine does appear to improve cholesterol. However, these findings need to be interpreted with caution, again because of the high clinical heterogeneity and high risk of bias in the included trials. But for me, this brings us back to the debate between traditional and Western medicine. We do have medications now that potently block PCSK9. So if the reason for taking berberine is to improve cholesterol, why not do that by a great diet, regular exercise, and then using medications that block or activate certain pathways? We know that those medications can be absorbed, and we know the effect that they're going to have on the body. Personally, I'm deeply grateful for the insights that traditional medicine has provided. It's given us clues that needed further research, and now that we understand how some of those traditional medicines work, we can make medications to potently activate specific pathways. Overall, for me, I don't take either berberine or metformin. There doesn't seem to be a strong reason to try and activate AMPK for non-diabetic patients, and if I want to improve my cholesterol, I would do that through diet and exercise. And for some of my patients who need extra help with their cholesterol, I use either statins or PCSK9 inhibitors. But please let me know in the comment section what you thought of this video and what you think about the differences between traditional and Western medicine. And a massive thank you to all of you who have donated to my rapamycin clinical trial. We've still got a long way to go, and I will be producing a video with an update on how it's going with the clinical trial design and ethics approval. And thank you to all of the patrons who support the channel. So until next time, thanks very much.